The liver is the power plant of human beings. Numerous functions of this organ are crucial for our body. Liver detoxification, cleansing, or formation of coagulation factors. The liver stores excess glucose and turns it into energy. Such an important organ, however, can also be vulnerable to various problems if we are not careful. An unfortunately already widespread disease is fatty liver. Researchers estimate that in Western countries, approximately 20 to 30% of the population suffer from the disease. Among the countries that are particularly affected, the United States. It is the most common chronic liver disease in Germany. Consumption of high amounts of starch and sugar are named as the culprits. But is this the only cause of a fatty liver? Fatty liver is a condition in which increased fat deposits are found in the liver. There are various forms based on degree of severity. The good news is that the liver is capable of regenerating itself. Thus, fatty liver, if detected early, can be cured with therapy. However, if it is not detected or treated, liver cells can change. This can lead to liver cirrhosis, inflammation, or even liver cancer. These diseases are not easily treated and can be fatal. Even if fatty liver is often casually regarded as a concomitant symptom, the disease should be taken seriously. In general, there are 3 pillars. Fatty liver can be the result of medication, poor diet, or disease. There are numerous medications, such as paracetamol, for example, that can only be metabolized by the liver. If these medications are taken too often, the liver can be damaged. Currently, poor diet is the primary topic, and excess weight and obesity are among the causes. Excessively fatty foods, high amounts of sugar, and little physical exercise is a combination that makes our body sick. Alcohol consumption can also be a trigger. The majority of alcoholics suffer from fatty liver. Patients who have hypertension or type 2 diabetes also are at an increased risk of developing fatty liver. The symptoms of fatty liver are nonspecific. Those affected are often tired, exhausted, and report abdominal symptoms such as bloating, loss of appetite, and sensation of pressure. Because the liver has no nerve cells, patients do not feel any pain. The sensation of pressure is created when the liver becomes enlarged. A diagnosis is made via ultrasound. Therapy is rather simple. Only a change in diet can regenerate the liver. In cases of alcohol-related fatty liver, complete abstinence from alcohol is the solution. In cases of non-alcohol-related fatty liver, a change in diet and adequate physical exercise are sufficient. Those with fatty liver should try to normalize their weight. Abdominal fat in particular can cause problems. Many patients still find it difficult to successfully change their habits on their own. Because there are no medications or surgical interventions available that could help, many patients struggle to find the strength to change their lives. But there is an option that patients can adopt to treat their liver without a great deal of effort. Chaga, a great option for those affected. Chaga is a mushroom that grows on birch trees and draws its special nutrients from the tree. It is a proven medicinal home remedy in many regions of the world. Also in reference to fatty liver, can chaga work miracles, as it can address all causes. Chaga has an anti-inflammatory effect. As already mentioned, inflammation is often the result of a weakened liver. The mushroom can fight directly against this reaction. But not only that, a weakened organ or a weakened immune system is susceptible to infections. Because chaga stimulates the production of immune cells through its immune-boosting effect, the body can better fight against invading viruses and bacteria. But it not only strengthens the immune system, but its antiviral effect ensures that viruses, for example hepatitis viruses, are unsuccessful or can be eliminated. If fatty liver is the primary issue, the cleansing properties of chaga can help eliminate toxins from the body and thereby achieve healing. Furthermore, stress, excess weight, and poor diet produce increasingly more free radicals that change and damage cells. Chaga contains numerous antioxidants that fight against free radicals. If the cause of fatty liver is another disease, a different approach should be used. It is important to always address the root of the problem. Chaga can help lower high blood pressure and high blood sugar levels associated with diabetes. It can also help lower LDL cholesterol, which can damage the heart and blood vessels. For patients who have excess weight, chaga's metabolism-stimulating effect can help reduce weight. Therapy with chaga is very simple. Patients should drink 2 cups of chaga tea per day. 1 cup contains approximately 400 milliliters. It is best to buy wild chaga in chunks. The first cup should be consumed directly after getting up in the morning on an empty stomach, about 30 minutes before the first meal. The second cup should be consumed in the afternoon. Allow adequate time before and after meals so the nutrients of the tea have the most effectiveness. Consuming chaga in the evenings is not recommended as it may have a negative impact on quality of sleep. The course of therapy may take several weeks or months, but with chaga, it is possible to heal the liver completely and to promote self-regeneration of the organ. Nonetheless, it is important that unhealthy habits be changed. Chaga has scientifically documented effects, but it is important that we protect our body and our organs. Because chaga has no side effects, you can consume it without worrying and allow it to work deep within your body and heal the liver, the power plant of our body.